Good afternoon, everyone. Thanks for joining us today. We are looking forward to bringing you this presentation. If you happen to have any questions as you go along, please feel free to put them in the questions box, and we'll get to them at the very end. We'll try to address all your questions, and if for some reason there's too many, we will be sure to reach out to you individually to get your questions answered. Again, my name is Theresa Richardson. I'm a partner and Chief Talent Officer with the firm of Withum, Smith & Brown. Been with the firm a little bit over, I don't know, it's almost 23 years now, I guess. Started as a staff one accountant and became partner, and about 4 years ago became Chief Talent Officer. So basically that means I oversee anything and everything to do with our talent, which is recruiting, HR, learning development, coaching, everything. So as a result of the pandemic, I was tasked with coming up with protocols for our firm and how to return to work, and it's what's brought me here today. Next, Anthony, you want to introduce yourself?
Hi, good afternoon, everybody. Thank you for sharing an hour of your time today with us. I'm a lawyer, labor and employment lawyer. I've probably dealt with many of you on this list in terms of your planning, and we've laughed and cried about many things going on during COVID. So today should be laughs mostly. We will try to make this a little bit fun for you, but at the same time, you know, you got some serious issues to deal with over the next few weeks and months. And Theresa and I will do our best to get you started on your plan forward. So we look forward to the time. And this one's mine. Of course, Theresa leaves it to the lawyer to disclaim this. This is an informational purpose only seminar. It's not legal or accounting advice specific to any client or matter. So please remember, this is informational today and not to be relied on specifically for your particular company situations.
Okay, with that, we'll get started. So, you know, reopening your business may feel like the light at the end of a shutdown tunnel. It's a first step toward opening the economy and restoring normalcy to our everyday lives. However, until there's a vaccine, it is crucial to remain vigilant by taking preventive measures to protect the health and wellness of your team members and the communities you serve.
So on to our first polling question.
How many employees do you have at your practice? Please select one.
And for those getting CLE or CPE requirements, these are important questions to verify that you are listening and paying attention. So please do select them so your applicable authority knows you were here and participated.
All right, about 15 more seconds. I'm going to close it out, and here are the results.
Okay, looks like we have the bulk that are 50 plus, and then followed up by 1 to 15, and then 31 to 50, and 16 to 30. Excellent. Thanks for answering that question for us. Okay, so next we're going to talk a little bit about staying home and working from home. I'm going to cover the 3 different areas in which this would apply. So obviously during a shelter in place, everyone is strongly encouraged to work from home. But as companies begin to reopen, there are certain circumstances which may be advisable or appropriate for your team members to stay home due to the virus. So the first one I'd like to discuss is symptoms of illness. If someone has any signs of communicable illness, including like a cough or a high temperature, a sore throat, but not limited to those of the virus, they should stay home. They should be expected to remain home until they're no longer contagious and self-quarantine, as directed by either their healthcare provider, local government officials, or otherwise may be appropriate. You may also expect your team member to seek appropriate medical care if need be. If your team member stays home and feels up to working, they should do so. They should remain consistent communication with regarding their assignments. The next area I'd like to talk about is in close contact with someone with symptoms of the virus, or someone who has tested positive with the virus, or someone who has recently traveled to or from a high-risk area. So if someone has been in close contact with someone with symptoms of the virus or with someone who had tested positive for the virus or awaiting test results, your team member should be expected to stay home for at least 14 days, which is the incubation period or other period that you determine for your company. An expectation in this situation, if the team member is not ill, is that the team member will continue to be productive for your company while they're home or working remotely to the extent possible. If someone has traveled to or from or is in close contact with somebody who has recently traveled to or from a country or region identified by the CDC as a high-risk area, they should expect to stay home for at least 14 days, again, the incubation period, or another period determined by your company. Now, if you're wondering where do I find out where a high-risk area is, you can always go to the CDC website and go to the travel section. They have a whole section there. You can plug in, maybe somebody's going to Aruba or Bahamas or something like that. It'll tell you if it's a high-risk area or not.
Well, Theresa, if I could just, this is Anthony. On the travel now, you may have heard in the past week or so, New Jersey, New York, Connecticut issued their travel advisory. And right now, I think New Jersey's up to 16 or 17 states that are recommended 14-day self-quarantines for people that are traveling back from those states.
Excellent. Great point, Anthony. Thank you. And I know I keep saying if someone has been in close contact. When we talk about close contact, that includes members of the same household or being within 6 feet or 30 minutes or longer of that person. Just wanted to clarify that. And the third case would be school or daycare closure, or now with camps, right? Because now it's summertime when we talk about camps. No, not too many kids are in school now, so we move over to camps. But if someone has an unexpected child or adult care needs based upon the school, daycare, or camp closure, consider them being permitted to work from home during such closure to the virus. And additionally, you might want to send someone home if they determine that you pose a risk to the health, safety, and wellness of your team members. Anthony, any other points on this you want to talk?
Yeah, I want to, just because we have all healthcare providers on the line. This slide is accurate. I want you all to remember when they first passed that Families First Coronavirus Protection Act, which had the expanded FMLA protections as well as the emergency sick leave on a federal level, which was a new world for most people. There is an exemption for healthcare providers, so you will very likely get pushback from employees saying, well, I'm entitled to work from home. And that's been coming up a lot because you'll hear conflicting things. For healthcare providers and unique to healthcare providers, you guys do have the right to exempt your employees from their federal leave rights under the federal emergency sick leave law, as well as the federal emergency family medical leave. That was the 12 weeks of paid leave that came out earlier this year. So if I trust you are all aware of that at this point, but if you're not, make sure you reach out offline to make sure you're not otherwise giving out leave that you don't need to employees.
Okay, next we're going to talk about documentation. You may want to consider obtaining appropriate medical documentation for both confirming the existence of your team member's symptoms or that of another person with whom the team member has been in close contact with, as well as medical clearance or fitness to return to work and the office, including but not limited to a negative test result for the virus. If someone stays home due to childcare needs because of school or daycare or camp closure, you can obtain the appropriate documentation for confirmation purposes. There's nothing wrong with communicating, and asking your employees for confirmation that they have the virus, they're negative to return to work, or confirmation that their daycare is closed or whatnot. So there's nothing wrong with asking for confirmation of documentation.
Right, and remember, you can ask for a test result for COVID. You cannot, and I repeat, cannot ask for the antibody test results. So just remember that and write that down. That's important. You can ask for the COVID test result. You cannot ask for an antibody test result.
Okay. So communication. Continued transparency and clarity are vital to your reopening. Prevent confusion among your team members by answering these questions before opening your business, and they are. Where will your team members find supplies? You know, do they need to go to the closet? Do they need to go to a person in HR? Do they need to go to the office manager? Will be at the front desk. You want to let them know where they can find supplies. Who will be responsible for providing those supplies? Is it going to be your HR department? Is it going to be your office manager or someone else? What parts of their workspace will be closed? You know, some desks are not 6 feet apart from each other, so some offices might choose to close down a certain desk or two. You're going to want to notify people of that. Will conference rooms and cafeterias remain open? I know some conference rooms in some companies are being repurposed for office space. Cafeterias, some are opening, some are not. So again, you want to make people aware so they know whether they need to bring in a lunch or not. Who will be allowed in the building and when? And when I say that is I know a lot of landlords are saying, you know, there's only a certain amount of capacity that are allowed in the building at a time. So I know, like for instance, in Boston, our company there, they started out allowing only 25% of our capacity in the office. Now they just moved up to 50%. So you just want to be aware of what the capacity rules, if any, are in your building. And what gear will be required to enter the building? Will it be face masks? Will it be gloves, sanitizers, Clorox wipes, anything like that? You want to let them know what supplies you're providing and which supplies are required. You want to communicate with your team members through any and all means, and that could be you can host online meetings, you can make phone calls, you can send out mass texts and emails. Once your workplace reopens, consider posting CDC signage in entryways, bathrooms, and other common areas. Again, the CDC website has a section in there where you can go and print out posters that are very helpful. It talks about how to properly dispose of masks and gloves and whatnot, and like how to cover yourself while coughing and stuff like that. There's a bunch of good signage on there that you can print out and put right in your office space.
Okay, on to our second polling question. Has your office returned to work? All right, about 10 more seconds. Okay, I'm going to close it out, and here are the results.
Okay, yes, we are starting to 66%. It's great. Not yet, 26%, and NA is 8%. Okay, very good. Okay, next we'll talk a little bit about staggered teams. What we've done at Withum and some of our clients, what they've done is they've staggered their entry back into the offices. So you might have a week where maybe team A goes in, maybe that's half the office, and the other team is considered team B and they go in for the second week. Or they have staggered days where maybe someone comes in Monday, Wednesday, Friday, and the others come in on Tuesday, Thursdays. This is a way to spread out, you know, having full capacity in the office at one time. Again, you know, maybe week to week is even better, because if somebody gets sick in the office, you know, you'll know who was in the office for that week, and then the other team has not been in the office that week, so you might have the chance of spreading out the virus that way, you know, stopping it from going to another person that hasn't been there the entire week. So staggered teams is a good approach to consider for your offices. Okay, testing and screening. When available, you might want to have your team members tested for the virus or antibodies. So I know Anthony was saying we should not test for antibodies, and antibody testing, really, just to let you know, as many of you probably already know, it's really just used for academia purposes right now. It's not really 100% proof that you can't get the virus again. And testing for the virus, you know, it's a snapshot in time, right? So you could test negative for the virus today, you could go to work, you could go home and get the virus tomorrow, you know, so, you know, it's just a snapshot in time. But people are really considering, you know, having their temperatures taken. That's what we're doing at the firm, and I know many companies are doing all over the place. So, and not only for your team members, but you want to have your clients, any guests, any vendors, anyone that's entering your office space to have their temperature taken as well, if you decide to do temperature takes. Because we don't want to discriminate against anyone. We want to treat everyone the same that's walking through the door. And the temperature that you need to be concerned about as per the CDC is 100.4 degrees. If your temperature is taken above that, you will want to tell the person not to enter the building, or the office, I should say. And the other thing, you know, you may want to consider is using infrared thermometers. So you don't have to touch anyone's skin. There's other equipment out there I've seen where it almost looks like you're walking through security at an airport, but there's this equipment that you can walk through, and it'll pick up your temperature as you walk through, and it'll register in the system, and it goes to someone in leadership. Or there's even these machines where you can just stick your wrist underneath a machine and it'll read your temperature and again record it as well. There's many different ways for temperature taking. Okay, and then in addition to temperature testing, you can ask everyone to complete a questionnaire prior to entering the offices. Questions that you could use could consist of these 4 I have listed here. Have you returned from any of the countries or high-risk areas listed on the COVID facts within the last 14 days? Have you had close contact with or cared for someone diagnosed with the virus within the last 14 days? Have you been in close contact with anyone who's traveled within the last 14 days to one of the countries listed as a high-risk country or a hotspot? Or have you experienced any cold or flu-like symptoms in the last 14 days? That could include fever, coughs, sore throat, respiratory illness, difficulty breathing. If the answer is yes to any of these questions, access to the office should probably be denied. I know, Anthony, you and I had a chuckle yesterday, right? Because we were talking about fevers existed before this and they're going to exist after this.
Yeah, it's tough. I mean, I think for medical practices, taking the temperatures isn't a big deal. You guys do it all the time. But some people say if they have a fever over 100.4, don't let them into the office. I have other practices that are saying, look, if they don't have other symptoms, we're not necessarily going to exclude them. So you got to make the judgment for your practice and how you're going to work it.
Okay. Next, we'll talk about prevention. You may want to consider sanitizing your office space prior to reopening and continue on as needed basis. You should expect all your team members to use the same common sense and professional courtesy they do during flu season to prevent the spread of the illness, including to, but not limited to, obviously, thorough and frequent hand washing, respiratory etiquette. You should have masks, sanitizers, Clorox wipes, gloves throughout the office for your use, as well as soap and water in all the restrooms and the kitchens. Use your knuckle to touch light switches, elevator buttons, etc. When opening doors, especially bathroom doors or public area doors, consider using paper towel or tissue or disposable glove to do that, to open those doors. You might want to require your team members to wear face masks while in the office, unless the team member can maintain at least a 6-foot distance from other team members or people, or wearing the mask. Unless the mask, for some, it would damage a team member's health. That would something you need to talk to your team member about. Team members should be expected to clean and disinfect frequently touched objects and surfaces such as workstations, keyboards, telephones, handrails, and other doorknobs. They should avoid other team members' phones, desks, offices, and other work tools and equipment when possible. If necessary, clean and disinfect them before and after use. Kind of like when you go to the gym, right? You wipe down your equipment, you use it, and then after you get off, you wipe it down again. It's the same thought process here, before and after use disinfection. CDC posters that can encourage hygiene to help to stop the spread should be placed at the entrance to your office and other workplace areas where they're likely to be seen. Again, you can refer to the CDC website for these posters if need be. Anthony, do you want to talk about the CDC website for purposes of liability purposes?
Well, I think if you read all the guidance, it's really what it is. There's, in terms of protecting yourselves from liability, look, your healthcare practices, that doesn't necessarily mean if someone contracts COVID at work that it will necessarily be covered by workers' comp, because the problem with that will always be, well, how did you really contract it? Did you contract it at work or not? Now, if you have a practice where you are actively seeing known COVID positive patients or likely positive, that's your practice, I think the employee who gets COVID probably has a great workers' comp case that it was from work. But a normal medical practice where, you know, a dermatology practice, a plastic surgery practice, any other generic practice that is not in the business of COVID, I think the employee has a harder time making a workers' comp claim if they get COVID, because I think proving they got it from work will be damn near impossible. That being said, now you're left with, can the employees sue you if they get it? I think they have a very uphill battle. I don't think there will be a rash of claims, except if you're one of those practices who just completely ignores all the guidance out there and doesn't do anything. In other words, you don't do the basics of social distance, wear gloves, sanitize, and wear masks. You don't do those basics, I think you're exposing yourself unnecessarily, especially given what you guys do as a business.
Excellent. Okay, next we're going to talk a little bit about social distancing. So team members should be advised to use telephone calls, virtual meetings, online conferencing, email, instant messaging to conduct business as much as possible, even when team members are in the same building. If a face-to-face meeting is unavoidable, the meeting time should be for a minimum period, maybe in a large meeting room, and participants should sit probably at least 6 feet away from each other if possible. You want to avoid person-to-person contact, such as shaking hands. Avoid unnecessary travel for business or pleasure. Maybe consider canceling or postponing such travel, as well as any non-essential meetings, gatherings, workshops, and training sessions until which time the virus is no longer widespread or present. Avoid congregating in conference rooms, huddle rooms, cafeterias, pantries, copy rooms, and other areas where people socialize. Consider limiting meetings to no more than 10 at a time. For meetings in conference rooms, you should attempt to keep appropriate social distancing and wear masks in closed environments. You may want to consider eating at your desk or away from others. Maybe bring your lunch or purchase takeout meals. If you plan to eat lunch in a cafeteria or in a kitchen or in a break room, you should consider sitting 6 feet apart from others. You want to avoid group meals, buffet-like meals during COVID-19. I know at our firm we had a little bit of uproar when we said we're not going to have Bagel Thursdays anymore. If feasible, maybe avoid using public transportation during rush hour, crowding. Maybe consider walking or cycling or driving a car whenever possible. Alternatively, if possible, you can adjust your schedule to commute early or late to avoid rush hour crowding on public transportation. Try to avoid recreational or other leisure classes, meetings, and activities where you might encounter contagious people. Avoid handshaking as a means of a greeting. I know that what we've done, we've actually printed a sign that we hang in all of our receptionist desks as soon as any of our clients or guests walk into our offices. And it's basically it's a no handshake zone, and it pretty much says something like, hey, we know we've built a lot of our relationships on a handshake, but this time, in order to help prevent the spread of the virus, we are not doing a handshake. So something like that goes a long way. And you might want to avoid riding in a crowded elevator. Limit riding in an elevator to no more than 1 or 2 people at a time. I know a lot of the companies in buildings, the landlords have specific protocols they're following, such as having 1 or 2 people in an elevator at a time. I know that can cause a chaos if anyone's working in New York and you have to go up several floors or something like that. But again, something to consider, just not to have a crowded elevator because you're in a closed area.
Okay, on to our third polling question. Did your practice provide telehealth appointments prior to the COVID-19 crisis? All right, about 15 more seconds. Be sure to get your answers in. I'm going to close it out, and here are the results.
Interesting. We did see a big increase in telehealth after COVID. So, and as a patient, I enjoyed telehealth personally. Saved me a lot of trouble driving to the practice just for a routine appointment. So.
Okay, Anthony?
Yep. All right, guys. I'm sure most of you are familiar. The DCA recently put out for healthcare services and office practices. They put out an administrative order. It's known as 2020-07. And so a lot of what you see will be from there. But with regard to patients coming to your office, because let's face it, from a reopening, it's one thing just setting up the office and how you're going to clean and disinfect and all that, but you now have your employees, who many of whom are scared and nervous, and they're now dealing with patients who are coming in who are also scared and nervous. And so it's just, you take reasonable steps to try and quell that. And so just leading up to the visit, when you're scheduling, what DCA has said, and I think a lot of you were doing this to begin with, that you call them. Do they really need to come in person or not? Okay. You ask them those basic health questions about, do they have any symptoms? Do you have COVID? Have you tested positive for COVID? Now, patients, you actually could ask about, have you tested positive for the antibody? It's not an employee, so you would be able to ask the patient that. And the point of all this is to sort through whether this person is likely to have COVID when they come to the office. And if you still determine as the doctor that even with those symptoms that they need to come in, you'll take the necessary precautions. So you'll also have to become scheduling masters. I hope you all are already, but whoever your schedules are, they're going to start to have to account for, look, how many are we scheduling at one time? And I can tell you, whatever the number was pre-COVID, it's certainly not going to be at that level, because you want to make sure you don't have patients sitting around next to each other in the same place for any sort of extended period of time. If the patients you interview over the phone say, yes, I have COVID now, or I had it, but I've quarantined for 14 days, or I have symptoms and I think I have it, you're going to want to try and schedule those types of patients at one time of the day. And so the DCA suggested end of the day, I don't really care one way or the other. I like end of the day because I think you're going to disinfect and clean that night. But you'll have a separate spot for those patients to come into and to wait in. And for some of you, I've seen this happen. You will tell patients, all right, when you get to the office, call this direct dial number and tell us you're here. And they will tell you, okay, yes, come upstairs, or here, we will call you when to come upstairs. So that's some basics you can do. And they're nice, easy to follow steps with regard to scheduling and setting up the appointment. We can go to the next slide, guys. So during the office visit, so we've now, our scheduling staff has done their job. They've done all their screening, and now we're all, patients are coming through the door. Again, when the patient comes in the door, you're going to ask them the same level of questions. Do you have COVID? Do you have any symptoms, et cetera? You're going to ask them if they reside with anyone who has COVID or not. You're going to ask them now about, have you traveled recently to any of it is 16 states, I confirmed it with the Department of Health, whether they've traveled from any of the 16 states in the past 14 days. If the answer to that is yes, you again have to make the decision as a practice. Are you going to put them with the likely COVID people? Are you going to say, we're not going to see you today? Things like that. There's no right or wrong answer to that, because the travel advisory, to many people's surprise, I think they, out of the goodness of their civic duty, they hear travel advisory and they think, okay, we have to quarantine. If you read the travel advisory, I hate to say it, but it says it's voluntary compliance. And so a patient who maybe should be self-quarantining doesn't necessarily have to, and I don't really have a protection against that, but you should be aware of that, that the travel advisory self-quarantine is truly just an advisory at this point. And then obviously, you'll take their temperature for each time they come in and log their temperature. Let's go to the next slide. And this was finally the administrative order I mentioned. And we can certainly make available as part of the materials a copy of the order. It came out in May. The order, just to give you the highlights if you haven't read it, the order is designed to give you the office and practice settings guidance. And it has areas from avoiding person-to-person contact in the offices, facilitating social distancing in the office, adopting enhanced cleaning and disinfection, and then one of them is establishing rigorous protections for the staff, and requiring you to stay on top of things from the CDC and the state. It's about a 10-page document. It's a thrilling read. So anybody who wants a copy of it who hasn't seen it already, just let us know and we'll certainly make it available to everyone on the line. You can go to the next slide. Do you want to take over, Theresa?
Sure.
Hello?
Contact tracing. So for team members who've been diagnosed with the virus, you might want to conduct an interview to determine who the team member may have been recently in contact with. You'll probably want to inform other team members that an unnamed team member has been diagnosed with the virus, and if other team members have been exposed to the disease, so that the team members may take any necessary measures to protect their own health. If other team members were in contact with the person testing positive, they should be asked to self-quarantine. You may also consider informing subcontractors, vendors, suppliers, or any visitors that an unnamed team member has been diagnosed with the virus, so that they can take the proper measures to protect their own health. If the team member had been to an office prior to testing positive, you might want to close the office prior to sanitizing. Okay, support. So this is just a little something we did at Withum, and it went a very long way for our team members. We created some support groups, a working parent support group, a general support group, and then we talked to them about our team member assistance program or employee assistance program. Because managing through the virus pandemic can be very emotional and mentally exhausting time. But being involved in a support group can make one feel less stressed about the situation by helping you realize that you're not in it alone. You can share your experiences too through that piece. Having a support group also enables one to seek out the advice of others and helps give you a sense of control over the situation. So if you have an interest, you may want to consider developing these groups for your offices. Also, we have an employee assistance program through our medical insurance. And it's basically there for anyone that it's free, and they can reach out to it's a phone number that they dial into and they get free advice. If they're struggling with anything, there's a lot of professionals out there that will help coach you through a difficult time. Benefits. So I bring this up because as many people were working from home, a lot of people changed their benefits. One of them being dependent care, another being their FSA, another being their commuter and parking. People were reducing their benefits because they knew they weren't going to be using them. But something to consider is that now that people are returning back to the office, you might want to consider joining back into these or increasing your benefit amount again. It's just a little reminder to put out to everyone. It never hurts. And again, these are subject to annual limits, of course, but it's a good reminder for everybody. Okay, another thing maybe consider is training. Maybe consider doing as much training virtually as possible. I know we've gone virtual with all of our training through June of 2021 for the time being. I know it's not always perfect to be virtual, but as things open up, maybe things start to go live. But I would suggest, to consider doing as much training online virtually as much as possible, so you can avoid being in contact with others.
OSHA, that's my favorite. Let me Theresa, I'm going to make a comment on OSHA.
Sure.
So the healthcare practices, you guys should all be familiar with OSHA. And I think I said at the beginning, a lot of what we see out there is not new law or regulation. It's a lot of guidance and advisory things that they're just not legally binding. And so Theresa asked a good question about protecting yourselves from liability. Well, I want to read you the first two sentences from OSHA's website on healthcare workers and employers about COVID, because they have not issued a single new regulation or standard. And so all they say is, quote, "This guidance is not a standard or regulation, and it creates no new legal obligations, period. It contains recommendations as well as descriptions of mandatory safety and health standards, period. The recommendations are advisory in nature, informational in content, and are intended to assist employers in providing a safe and healthful workplace, period." What does that translate into for you guys? You're familiar with OSHA, you're familiar with their general healthcare general standards, as well as some of their specific healthcare standards. So that hasn't changed. And so everything you see from OSHA now, guys, it's trying to help you, but it has not changed your kind of minimum level of what you need to do to comply with the safety standards in OSHA. And so I do not envision OSHA going on a mass campaign to go after healthcare practices in the near future. But I want you to be aware that, you know, whoever your OSHA consultant is, whether they're in-house or an external one, they should still be relying on what they've always known. And so if they tell you, well, look, we don't really know what we should be doing, well, it's time for a new OSHA consultant, because they haven't read what OSHA is saying about all this. So stick with what you know, add those few extra add-ons like we've discussed today. But if you stick with what you know and you've always been good with OSHA, you guys should be fine and not going to be facing any penalties from OSHA in the near future.
Excellent. Excellent advice. Health procedures. These next several slides I'm going to go through, and these are different protocols that you can consider using in your respective offices. So the first one is, what do I do if a team member shows symptoms of the COVID virus? You want to send them home immediately. If they aren't already working from home, advise them to contact their doctor immediately, advise them to keep their direct report updated on their status. You might want to consider deep cleaning the practice office. If the team member's been there within the last 14 days, notify HR so that HR can notify how to, self-monitor and self-quarantine at home. And they shouldn't return back to the office until symptoms are gone for at least 72 hours without the use of symptom-reducing medication. Okay. Now, what do I do if a team member tests positive for the virus? If they learn of this while they're in the office, send them home immediately. Notify all team members of the exposure and send them home as well. You want to consider deep cleaning the office, close the office for 14 days, notify any team members from other offices or who may have visited the office in the last 14 days. Advise all team members to self-monitor for 14 days. Notify HR. Advise team members to keep in contact with a direct report, and again, require a doctor's note. So a lot of these, you're going to see the same, somewhat of the same protocols, but I think it's important to go through the different situations. Next slide. What do I do if a team member's family member shows symptoms of the virus? Okay, you're going to want to advise a team member to work from home or stay home under the terms of the company's time off policy. They should practice social distancing and self-monitoring within their own home. Again, notify HR, keep their direct report informed. Shouldn't return to the office until their family member symptoms are gone for at least 72 hours without the use of symptom-reducing medication. And if the family member develops the virus, then follow the guidelines on the next screen. Okay, what do I do if a team member's family member tests positive for the virus? Again, send the team member home immediately if they aren't already working from home. The team member should self-quarantine, notify all team members about possible exposure, identify and notify team members from the offices who may have visited in the last 14 days, close the office, deep clean it, Again, you'll see some of these same guidelines, but it's just important to run through these. Next slide. What do I do if a team member is possibly exposed to the virus? Send the team member home immediately if they aren't working from home already. Advise them to self-monitor for 14 days. Advise them to keep their direct report updated. You can notify office members of the possible exposure. Identify and notify any visiting team members from other offices. Consider deep cleaning. Notify HR, and so forth. The same thing.
Theresa, on the notifying office members, just remember you are still dealing with HIPAA and employee confidentiality of health info. So if an employee tests positive, now I've seen so far most employees in the clients I have, they've actually said to the employer, it's okay if you tell people it was me, but if they're not okay with that, when you do your contact tracing for that employee as to who they may have run into, you would basically identify those employees and just go to them quietly and confidentially without telling them who, just saying, look, someone in the office tested positive and when we contact traced, they came across your path in the past, 5 days, 4 days, whatever it is. And so we wanted to notify you so you can take appropriate steps for yourself. So just if the employee does not consent to their name being disclosed, you can't legally do that.
Excellent. Okay, and what do I do if the virus is present in the office or another business in our building? You basically are going to want to share any communications from building maintenance with all members of your office. Identify and contact and share with any of the team members from other offices who may have visited the building in the last 14 days, close the office for 14 days. If somebody in your office gets the virus, you're going to want to let your landlord know that as well, so that they can send out the appropriate notifications to their, again, keeping the name confidential, as Anthony mentioned, but you're going to want to notify as many people as possible.
All right, on to our fourth and final polling question. Are you having trouble with your employees coming back to work due to childcare issues, etc.?
I can answer that one for everybody. That's going to be about a 90+% yes.
All right, about 10 more seconds. All right, I'm going to close it out, and here are the results.
Oh, I was low on that one. I'm too high on that one. I'm sorry. You guys have good workers.
Okay.
So why don't we start looking at the questions, Theresa? Sound good?
Sure, absolutely. Yeah, and the last point I was just going to make empathy is just remember that every person faces a unique impact from the novel virus, right? So returning to work, embracing the new normal is just an adjustment for everyone. But with proper planning, you can make the transition of reopening your business feel as safe and as smooth as possible. So if we look at our questions, let's see what we have.
So we got, I'll just start from the first one. So we got essentially the question is, if somebody has to stay home to self-quarantine and they can't work from home for whatever reason, they have a job that is not, you can't do it from home, or they don't have technology and the practice is not providing them technology, what are your requirements specifically regarding pay? So this goes back to something I said in the beginning about the federal sick leave and family leave expansion. Because you're healthcare providers, it's very important you do this the right way if you don't want to pay them while they're out. Now, you can't fire them if they need to quarantine, because the state of New Jersey has said if somebody needs to quarantine because of COVID, you can't fire them. Now, that doesn't mean you need to pay them while they're on leave. So if they have paid time off time, so for example, New Jersey earned sick leave, that would cover them for up to 40 hours if they have the time in the bank. And so, yes, during the 14 days of that, if they have earned sick time under New Jersey state law, you would have to let them use that for that leave. However, the federal sick leave law, which was the 2 weeks of pay, you, as healthcare providers, as long as we fill out the right paperwork and exempt ourselves from it for that employee, you will not have to pay them for the rest of that leave time. Now, some of you as practices may decide to pay them because you get a tax credit for the money, but that's a business judgment on your end. But legally speaking, you do not have to pay them. As a practical matter, my suggestion to all of you is, if they have sick or paid time off in the bank and they're going to be out for 2 weeks and truly can't work, if your policy allows it, I would force them to use that time and pay them, because you don't want a situation of them being out for 14 days, but they had 2 weeks of vacation in the bank. And now later this summer, they go, oh, by the way, boss, I'm taking 2 weeks off now. And now you've just lost another 2 weeks of work. So that's just more of a practical suggestion. So that was the first question. Let's see.
Are we expected to pay someone for the 14 days quarantine if they choose to travel to Florida? Okay, I think you covered that.
Yeah, I think we covered that. Again, you could make the choice, but it's not legally required for healthcare providers. The only thing that's required is if they're quarantining because of COVID, you can't fire them for it. So the question next was, the reopening their administrative office on Monday, do they need to ask all employees to get tested for COVID before they return? It is not required, but you are permitted to ask all employees to get tested for COVID before they return. So there's a comment. Someone said some of us never close. That's true. And many of you have been working hard the whole time, and we certainly appreciate that.
Yes,
next question was, if we cannot provide 6 feet of distance between desks, but we have plexiglass between each station, is that okay? Yes, under that DCA guideline, administrative order, that's 2020-07, which an administrative order, just so you know, is law. So you do have to follow it. They actually say in there, yes, you need 6 feet apart where possible. So if your workstations are that close together and cannot physically be moved apart, and you have too many people to, space them out and leave a desk open, then yes, the plexiglass barriers would work in that situation. But I would encourage you to really look at the setup before you go assuming they can't be spread out 6 feet or have people work, skip a desk type thing. Next was, are full plexiglass barriers sufficient between the staff at less than 6 feet apart? We just answered that one. Someone has a cough, went to get tested and was negative. Can they still return to work even with a cough? Yes, I would be fine with that. I know the problem is, sometimes you won't test positive for several days later, but you have to make a judgment call. Coughs, like a fever, or if we're talking about just a cough, we all know coughs have been around before, they'll be around after. So if it's my medical practice, I'm probably going to allow them back, but you can make that judgment call. Just try to be consistent, guys, because if you allow the older worker to stay home with the cough and the younger worker not, you might get an age discrimination claim, and I think you see where we're going with that. We are in the midst of summer vacation season. That being the case, is it appropriate for the practice to require those staff who travel to domestic hotspots to self-quarantine before they return? The answer to that one is easily yes. In fact, the travel advisory would suggest that. Do we have to pay them? We answered that. Again, if they have New Jersey sick leave in the bank, yes. Beyond that, legally, no. But you'll want to handle that the right way to make sure you don't trip up under federal law. Guidelines appear to be different for healthcare providers for COVID and suspected COVID. Well, that's because healthcare providers are in a different position than the rest of the businesses out there. And so whatever differences there are, I'm not the governor, I'm not the heads of the agencies. So you'll have to call your lobbyist to get those changed. Someone says, does the exemption apply to all employees of the practice, even those who do not have contact with, do not have direct patient contact? If the exemption you're referring to is from the federal sick and emergency laws, then yes, the exemption applies to any employee of the healthcare practice. And that is different than when the law first came out. When the statute was passed, it said healthcare providers could be exempt from the federal sick and family leave expansion, and the healthcare community, to use the technical term, went ballistic on their congressmen and senators, and rightfully so, because they said, it doesn't help us to say the doctors and nurses are exempt. What about all our staff? And so within weeks of the law coming out, the U.S. Department of Labor issued issued guidance that said, no, healthcare provider means anybody that works for the practice. Someone asked, do the barriers have to be floor to ceiling? No, they don't have to be floor to ceiling, guys. Typically the desks, but they should be a good 6 to 8 feet high. I'm looking at when I see them. We did them in my office. They do not go all the way to the ceiling, but they're definitely taller than the average person. How do you recommend handling, we talked about coughs and fevers. What do you do if the same staff member repeatedly says the same symptoms? Yes, that is a likely event. What you can do is send them home, tell them to go to the doctor and get tested for COVID. And if they come back with a negative test, you can tell them work. And if you want, there are some positions in your healthcare practice that can be performed from home. So you can make them work remotely for that period of time. They get tested, you want to make them work from home for another 10 or 14 days, you can do that. But you can make them work from home. And the last couple questions. Can an employee refuse to work if they are uncomfortable? They have been allowed to work from home over the past few months, or at least until there is a vaccine. So this is coming up a lot. And unfortunately, several months of working from home has made many employees feel, well, I do fine at home, so I should just be able to work from home. So here is your unequivocal, very few black and white answers you'll ever get from a lawyer. Someone being uncomfortable is not a reason for them to refuse to come to work. It is also not a reason for you to, quote, accommodate them to work from home. Now here's the exception. Once the employee, what we've been doing is say, look, you send out the return to work notice, just set the plan, okay, and pick the date. Here's the return to work notice. Whether you're doing staggered returns in terms of, first we're going to do, clinical staff, then we're going to do admin staff, or we're going to do 50-50 staff coming back. Whatever the plan is, set the plan. Set the date, send the notice, and that notice should say, your return to work date is X. Please email us at X address to advise whether that you intend to return to work on that day. That is step one. Step two is inevitably dealing with the varying responses you will get. You'll have a 30-year workforce will say, okay, great, can't wait, looking forward to be back to work, want to get out of the house with all my kids because frankly, I'm going crazy. Then a 30-year workforce will say, wow, I'm not ready yet. Can I get some more time? I need a few more weeks. I need to arrange childcare. And then the other third will say, heck no, I'm not coming back. This COVID thing's not solved. I'm not coming back till there's a vaccine. I'm using loose numbers, but that's likely what will happen. What you do when you start to get the requests, you now have to deal with them all on individual bases. And that is where it is very important that your practice manager, HR department, and your labor council all talk, because like I said, you have take bucket number one is, she said she's uncomfortable. That's not a reason. Get back to work. She doesn't come back to work. She's abandoned her job and she's not going to be eligible for unemployment. Bucket number two of the people saying, I need some more time. Here's why. Let's handle those requests on a case-by-case basis. Perfect example, if you're doing staggered returns and somebody that maybe was in the early group of returns said, look, I need another week or two because of childcare issues, I'm sure there's someone in the latter returning group that may want to switch with them. But the point is, you can work with them on that. And then the last group of, heck no, I'm not coming back. That group, you're going to say, what are your reasons for not coming back? And you make them write it to you in an email. And then your HR and practice manager sit down and review the reasons. And we decide whether there are any legal bases for you to accommodate them to work from home or have some further time out of the office. You have to do that for every request you get, and there's no way around that. So I think that's it. There's one more question. What if you have to yet again close your office because of others jeopardizing your building? Legality against the tenants or landlord for lack of cleaning. You got to look at your leases, guys, as to who's responsible for cleaning what areas. Typically, a landlord is responsible for the common areas. And so, look, if your building gets shut down by order of a local authority because the landlord was remiss in his duties, yeah, technically you probably have a claim against him for lost revenue. But I would hope you all start to get a good relationship with your landlord. Find out in advance what they're doing. The tenants should all be talking to the landlord, especially in these medical buildings. You know, you guys are usually the sole tenants with a couple other practices. You should be loud and vocal to the landlord to make sure they're not remiss and lax in their duties to keep it clean. And that was all the questions.
Thank you, Anthony.
Sure.
Great.
All right.
Thank you everyone for joining, and please be on lookout for our next webinar invite, and enjoy the 4th of July holiday.
Thank you, everyone.
Thanks, everybody. All right.